Hello, welcome to part 6 of the fresh question updates for paper A crash class. Question 12. Dr. Abdul Khan, an immigrant from Punjab, speaks English at work and enjoys going out for fish and chips with colleagues. When he goes home, he speaks Punjabi and wears traditional robes. What form of acculturation does this represent? A. Assimilation. B. Separation. C. Integration. D. Marginalization. E. Rejection. So this question again refers to Berry's model of acculturation, which we have visited in previous lectures. So basically, there are four types based on how much do we integrate with the new culture and how much we keep the previous culture from which we originate. So it is about the mixing between the culture of origin and culture of immigration. In people who, in this case, it looks like that this person is actually having a high degree of adoption of new culture as well as high degree of retention of original culture. He speaks his own language and he wears traditional dress at home, clothes at home. So this is integration. The answer for this one is integration. Question 13. The effectiveness of certain psychotropic medications can be affected by pharmacokinetics. Which of the following is an aspect of pharmacokinetics? Absorption, agonism, half-life, dose-response relationship, elation. So pharmacological concepts can be pharmacokinetic or pharmacodynamic concepts. What the drug does to your body is pharmacodynamic. What your body does to the drug is pharmacokinetic. So pharmacokinetic concepts include absorption, distribution, metabolism, and excretion. Pharmacodynamic concepts include agonism, antagonism, dose-response relationship, etc. Half-life, some part of half-life is determined by what the body does to your the drug that you take, and some of the half-life is related to the receptor actions of the drug. So the term half-life cuts across both. Question 13, absorption can be seen as a pharmacokinetic item. Question 14, Lucy is a 6-year-old girl who often speaks to her favorite doll. She tells her mother that her doll can talk as well. What is this an example of? A. Magical thinking. B. Symbolism. C. Artificialism. D. Egocentricity. E. Animism. So we've seen this before in one of the other lectures. These are all object-related concepts, largely Piagetian concepts, concepts such as magical thinking, artificialism, animism, and egocentricity. The concept of symbol is a Freudian concept. So what is animism? Animism is the belief that children hold sometimes that everything has life. For example, they will think the cloud is moving because cloud is a living object. This is called animism, and this is opposite of artificialism, where they think somebody intelligent is operating the world. So here Lucy thinks the doll that she has can talk as well. So this is animism. Children believe even non-living objects have life. Question 15. Psychotropic medications will sometimes enter adipose tissue and they become concentrated there. What properties of a drug aid its movement into fat tissue? A. Oxidation. B. Lipophilicity. C. Methylation. D. Chemical polarity. E. Hydrophobia. So lipophilicity is how much soluble in fat, how much fat soluble a drug is. That's called lipophilicity. This lipophilicity affects absorption, distribution, clearance, as well as blood-brain barrier penetration. So it's pretty important property. It's a very important pharmacokinetic property. The transcellular passage of drugs in the gut mucosa depends on the ability of the drug to penetrate the lipid bilayer. So if you're highly lipophilic, if the drug that you take is highly lipophilic, it's likely to be absorbed. Distribution as well depends on lipophilicity. Higher lipophilicity means higher plasma protein binding, so higher volume of distribution. The other thing about this is higher lipophilicity also means higher affinity to enzymes, so higher metabolic clearance as well. And blood-brain barrier is also going to be decided by blood-brain barrier penetration is also decided to some extent by the lipophilicity of the drugs. So drugs like propranolol, because they are lipid soluble, they enter the blood-brain barrier pretty quickly or easily. So four properties are affected by lipophilicity: absorption, clearance, distribution, as well as um, blood-brain barrier permeability. So question 15, please choose B, lipophilicity. 16. Functional MRI scanning of a patient experiencing auditory hallucinations is likely to show No changes, increased activity in thalamus, increased activity in frontal lobe, increased activity in the temporal cortex, reduced activity in the hippocampus. Now, when people actively hallucinate, and if you put them in the scanner and see what areas of brain is lighting up when they're hallucinating, this is called hallucination capture studies. This uses fMRI or PET scan to find out how much temporal activation, how much activation takes place in the brain, and which area is activated. This is a meta-analysis from Jardri, Reno Jardri in Lille, France. And this work clearly shows the hyperactivation is bilateral temporal in people who have active hallucinations. So this is D, option D, please. So question 17, Miss Alison Smart attends a dinner party with friends. While she is enjoying the company, she's constantly looking around to determine if she's behaving appropriately. Which phenomena does this describe? Social comparison, social perception, halo effect, social anxiety, conformity. So this is called social comparison theory. This was proposed by Festinger in 1954. It refers to the idea that there is a drive within individuals to gain accurate self-evaluations. This is often conducted via comparison with other people. Social perception is a study of how people form impressions of and make inferences of other people. Halo effect is a tendency for us to create an impression um, based on one area and let that impression influence other areas of judgment as well. So that's called halo effect. So in this question, Miss Alison Smart is comparing herself constantly, looking around other people. In other words, she's trying to keep up with the Jones, and this is social comparison. Question 18. Group therapy is often used to treat depression and anxiety. It also has a role in personality and substance misuse disorders. Which of the following is a therapeutic aspect of group therapy? A. Stereotyping. B. Projective identification. C. Sublimation. D. Universality. E. Intertwining. So Yalom's curative factors are important in group therapy. Of these, cohesiveness, learning from feedback, these are valued positively. Other therapeutic factors may not be that positive, but it's important to understand them. Installation of hope, universality, imparting information, altruism, corrective recapitulation, socializing techniques, imitative behavior, interpersonal learning, group cohesiveness, catharsis, and existential factors. These are all described as therapeutic factors within a group setting by Yalom. And particularly positive are cohesiveness and learning from feedback. So here, of the different things given here, therapeutic aspect, one of the therapeutic aspects is universality, as described by Yalom. What is universality? Strongly related to installation of hope. It allows members of the group to realize that they are not the only ones to experience a problem. In other words, this is a method of validation. People believe that the problem is not just their own unique problem. Many people in the world also have the same issues. That gives a sense of hope for patients dealing with specific issues. And this is an important factor in terms of success of group therapy and peer-to-peer support systems. MCQ 18, the answer is D, universality. 19, Mrs. Jane Andrews is 27 weeks pregnant when her husband begins to exhibit symptoms of tiredness, nausea, and abdominal swelling. Which of the following categories does this represent? Malingering, conversion disorder, somatization disorder, mood disorder, somatic hallucination. So what is happening here? This is called Couvade syndrome. In this syndrome, a very unusual syndrome, the partner of a pregnant woman starts experiencing pregnancy-related symptoms. It is described as a conversion disorder. The symptoms are not feigned and are usually recognized as unusual. They are not psychotic in nature by any way. MCQ 19, the answer is conversion disorder. Couvade syndrome is a conversion disorder. It's seen in the partner of a pregnant woman. Okay, let's look at the EMIs now. EMI 1, electrolyte abnormalities. What electrolyte abnormality could be expected in each of the following situations? Rani, a 52-year-old woman under the oncologists for breast cancer, complains of being excessively thirsty. So what is this? What kind of electrolyte problem she could have? Cancer and calcium. Hypercalcemia is relatively common in cancer. 20 to 30% of cancer patients develop hypercalcemia. And the most common cancers associated with hypercalcemia are breast cancer and lung cancer, as well as multiple myeloma. So this is likely in this patient as well, hypercalcemia. Question 2. Jay, 22 years old, was brought into the A&E in a coma. His friend George said that they had been at a rave where he thinks Jay may have taken something. He describes Jay as being very chatty and overfamiliar. He said that because Jay had a lot of alcohol before, his friends encouraged him to drink lots of water to sober up. So, what is happening here? It's likely that in a party like a rave situation, it's likely the patient has taken MDMA. And MDMA can induce excessive thirst. Jay has likely taken MDMA because he was chatty and overfamiliar, which can be induced by MDMA. And excessive thirst might have led him to drink excessive water as well, and that leads to secondary hyponatremia. So the answer here might be hyponatremia. More appropriate answer among the given choices is hyponatremia. Third question, Lena, 19 years old, is under her GP for low mood. In the past, she suffered from bulimia and struggles with her weight. Her boyfriend broke up with her a few days ago. Her friend Jess brings her to the A&E. As Jess noticed, Lena was a little confused. She also has a tremor and some numbness and is dizzy. So this is someone who had bulimia in the past and now they have numbness, etc. So this is likely to be metabolic alkalosis. What is metabolic alkalosis? When people who are bulimic, they repeatedly vomit. When they have excessive vomiting, it's likely that they lose quite a lot of acid. And when you lose acid, you become alkalotic. So this is metabolic alkalosis. It happens happens with loss of acid due to repeated vomiting. So just putting it all together, first question, the answer is hypercalcemia because of cancer. Second question, the answer is hyponatremia because of excess thirst and drinking excessively, drinking water compulsively. Third, it's metabolic alkalosis related to bulimic tendencies. Question two, movement disorders. So you have to match the type of movement disorder with the description given. Question a man who kicks his wife once as he falls asleep. So he kicks his wife as he falls asleep. Number two, a man on psychotropic medication for a long time who sleeps badly, wakes with a stiff back in the morning, and takes at least 10 minutes to get out of bed. So, this is a man with stiff back. Third, a man who experiences slow writhing movements in peripheral limbs. So, what are the conditions here? Now, just as a person falls asleep if they start kicking or having jerks, this is called sleep myoclonus or hypnic jerk. This is an involuntary twitch that occurs just as a person enters into sleep. This is different from REM sleep behavioral disorder, where it usually occurs in the later part when REM sleep becomes predominant. So hypnic jerk sleep myoclonus is in the early phase of the night, early night, but in the early morning you see REM sleep related behavioral disturbances. Parkinsonism is associated with antipsychotic use, and this can result in stiffness, bradykinesia, as well as tremor. Athetosis is a slow, involuntary writhing, not writing, sorry, it's writhing movements of the limbs caused by degeneration of the basal ganglia. This is seen in Huntington disease. It can also be seen secondary to stroke, cerebral palsy, or trauma. So, putting it all together, question one, it's a hypnic jerk. Question two is Parkinsonism. It's a patient on psychotropic for a long time with a stiff back. And question three is athetosis. Okay, so that brings close to the part six of our fresh question update. Make sure that you get fully familiar with the question bank. That's where the questions come from. Thank you very much.